Okay, welcome back, folks. So we're still on our nuts and bolts of being able to address our risks. So we've talked about our assets, and we found our risks. Then we talked about a way to categorize or prioritize those risks. Now we need that last piece of information we need before we can go do anything is how do we treat our risks? Just a note of caution, the term risk mitigation is not everything. That is one type. We're going to talk about others. So in this chapter, we'll talk about treatment, how you actually address a risk. Remember, we're trying to get our risk from a higher level down to a lower level. If you think in terms of a patient, when a clinician sees a patient, they want to be able to take the risks and reduce those medical risks to those patients. We're trying to do the same thing to our company, our organization. If you think about it, the whole purpose of the risk program that you have is literally to focus on your organization and treat it, triage it, fix it, treat it. That's what we're trying to do. So we'll talk about the 4 options that have here. Okay, so I mentioned 4 options to treat our risk. These are the actual options. We'll talk a little bit more in depth about these shortly. The first one is to transfer. Take your risk and transfer it to someone else. I'll give you some great examples of this in a little bit. The next piece is avoid or remove it. Literally, just chop it off and be done with it. This is the one most people assume and talk about as risk mitigation. This is where you actually do things to bring that risk from a higher level to a lower level. This typically involves spending resources, time, people, or money. Or you can accept the risk as is and just move on. So we'll talk about them. One of the things you need to be aware of is a term called residual risk. This is what happens when you do one of these 4 things. This is what's left over. When I talk about going from a higher level to a lower level risk, this lower level risk is your residual risk. By the way, your risk never goes away. You've still got a risk. Residual risk is what is left after you do one of these 4 things. I'll explain it in a couple examples as we talk about these 4 options. All right, let's talk about the first of those options. Transfer your risk. What do we mean when you transfer it? Most folks in here are using this in one way or another. Think of cloud, your email system, Office 365, if you're using Gmail, if you're using a third-party service. Instead of you having the risk of having the server and having to have the people to take care of the server and everything else, you've transferred all of that risk to that cloud provider and assume they're going to take care of it. Think about it. What would happen if your email server was broken down for 2 weeks? Pretty bad pretty bad risk there for you. In the cloud, you assume it's always going to be available. That's one of the reasons you use the cloud. Another piece of the insurance. Think of your cyber policy, cyber insurance policy that you have for your organization. Okay? The best analogy I have ever used for transfer, everyone in here has car insurance. Literally, you have car insurance. You buy a brand new $50,000 vehicle, you typically don't have, go without insurance, so should something occur that you got to pay all the damages to fix your vehicle, somebody else's vehicle, property damage, medical claims, all that. You carry insurance. You are transferring that possibility of a large loss to someone else. And you're paying them on a monthly, quarterly, annually, semi-annual basis for that, for them to assume some of that risk. I mentioned residual risk. Every one of you has a deductible for your car insurance. 100, 250, 500, 1,000, whatever your deductible is. That is your residual risk. It's what you specifically have exposure for. So if you bought that brand new $50,000 vehicle and you had an accident and it got totaled, You are only responsible for that $500, and the insurance company has the rest of that risk. That's what transfer is about, giving it to someone else to take care of, and then you've still got a little bit of risk left over, but not the majority of the risk. That gets us from again, our higher level down to our lower level where our residual risk is at. Okay, let's look at the next in our list of options. You can avoid or remove the risk. When I say avoid or remove it, that doesn't mean you spend money to do things or put something in place or replace it with something else. That's mitigation. We're talking about you literally remove the asset. You get rid of it completely. A technical example would be, we had a great big huge storage array that was on the back of one of our servers that the vendor, there was a security hole with it. The vendor decided it was too old. They weren't going to provide a patch. We actually got rid of it. Just literally moved the data someplace else that we already had, shut it down, took it out, destroyed the disks, and literally got rid of the asset. Think about all the paper that's in your office that may have PHI on it. EOBs, for example, that you're getting from your insurance companies. If it's paper and it's processed and it's sitting around, well, if you decide that we're just going to get rid of everything that's, not 6 months or older, and the shred guy comes in and you give them to them, you removed that. That is avoidance or removing that. So again, that brings your risk level from the higher level down to the lower level. That's what we're trying to do. But again, avoiding it means you've removed it. Okay, let's look at our third option we have, mitigation. This is what most folks think of when they think of treating a risk. Matter of fact, a lot of people use the term risk mitigation when actually they mean risk treatment because they assume they're just mitigating the risk. Some of the things that you can do to mitigate. So mitigation means you're still keeping it. You're not transferring the risk to someone else. You're going to keep it, but you've got to bring the risk level down. So you've got to spend some resources, again, typically time, people, or money, sometimes all three, and put them in place to bring your risk level from a higher risk level down to a lower risk level. Some of these things that we spend or expend resources on, the first one is a control, and that's literally something we put in place to bring us from a higher level to lower level. So for example, if your office just uses your vendors, your internet service provider's router to get to the internet, you may put a firewall between that and the rest of your network. By the way, you should always do this, but a lot of people don't. In smaller practices, it is not uncommon for you just to use the router that the internet provider gave you. A control would be something that's a long-term thought out. You've thought about this and then decided to expend the resources. A countermeasure is something you do in immediate terms when something occurs. So if you're getting, people walking in your door, for example, because risks are also in the physical realm, a countermeasure, you may have had somebody walk in your office that should not be there. A countermeasure may be you went out or called the locksmith and had them put in a deadbolt. Or you've put in like a badge swipe system or something that you put in to address an immediate concern. This typically you hear countermeasures used with something called incidents. Also, you need to build business cases for these mitigation steps. Remember, we ranked them, prioritize our risks. The highest ones, let's build a business case about it, because sometimes the resources you need to expend are expensive. Sometimes they're cheap. Just depends. But the more expensive ones, you should build a business case so you can prove to your organization This is what we see. This is the level we're at. If we expend these resources, we expect to see this at, our results at the end. And then after it's done, you can measure and see whether your return on your investment gave you what you wanted to do. Some of the typical managerial things that you do. We want to make sure, again, because this stuff is where we tend to expend most of our resources in cybersecurity, time, people, or money. We want to make sure we're doing it in a correct manner. We don't want to go willy-nilly. We don't want to spend to the moon. We also don't want to underspend. We want to do it just right. So using these things. But mitigation is about expending resources on something you are going to keep to continue on. Think about a laptop. If you're in fact, long-term post-acute care clinicians are the definition of a mobile medical professional. They're carrying laptops and tablets and maybe phones with them. You want to encrypt all that. So that is a mitigation in case of a loss or theft. If it's encrypted, you're covered. That's the one thing that CMS puts in black and white. If you encrypt something, you're covered. So that's a mitigation step, brings you from a higher risk level to a lower risk level, but you expended resources on it. Mitigation is about keeping the asset and expending your resources. So again, we'll go back to our options. You can transfer it. Think insurance. Transfer your risk to someone else. Think cloud. You're using Office 365 for email instead of you having to keep the email server and people employed that do it. You can avoid it or remove it. Get rid of the asset completely. Just stop using it, destroy it, whatever you have to do to dispose of that. You can mitigate it. Mitigation's about keeping the asset and then expending your resources to bring that from a higher risk level to a lower risk level. Notice we didn't talk about acceptance because that is very straightforward. You may have a business need to look at that risk and say, we just accept it because it may be lower than your risk appetite. Well, it gets already down low enough. Or maybe you have no option. Maybe it's a system you must use because there isn't a replacement, or you're in the middle of trying to replace it, but you still have to accept the risk of the old system being in place. Acceptance is straightforward. You say, yep, we're okay, we'll go with this as is. All of these are about bringing our risk from the higher level to the lower level where our residual risk is at. That's our leftover risk. Next chapter, I'm going to give you a tool that you can use to manage all of this and be able to, okay, we can work through this and get us from that higher level to the lower level.